Thanks so much for joining us on Speaking of Making Healthcare Work for You. And so our next interview is going to be with James Dold, who's on the leadership and development team at Mindoula, and he's a behavioral health specialist. So Apurv and I recently recorded the interview with James, and it was really great. He was so focused on collaborative care for behavioral health, because he was saying how it's not a problem for just one person or just the people who are suffering. It's a problem really for everybody, and that everybody could be part of the solution, which I really loved. From whether it's a school counselor to a primary care provider to online assessment tools, there are so many different ways to tap into the resources for people to just do a check-in and have a baseline. And there shouldn't be a stigma around having a baseline for your mental health. It's encouraged and it's great. And the more you know, the better. So I thought it was just a really innovative approach that he had, but so simple too. It wasn't a hard thing, but he did say, this is something that we need to spend funding on, because spending money on these things, behavioral health isn't something that's going to go away with COVID. It's something that existed before, and it's something that will exist after, but something that is certainly amplified during this time right now. But by spending money on the behavioral health and these systems to get people the best care that they can in their communities, it's going to help other things, from, potentially things like eliminating or reducing homelessness to hunger to suicide rates. Really, just I was so impressed by the broad spectrum that these simple, obvious in a way, techniques that he suggested could be implemented and make a huge difference. Apurv, what did you think about that? What stuck out to you about our conversation with him?
Definitely, you captured so much of the breadth of that conversation. I'm really impressed with what you retained. That's why I said you should be an expert here in healthcare. It's tremendous, really. I feel James, I know him over the last 15 years, but I don't know him in this way. And so getting a chance to view him through this lens was fascinating, because he's a really powerful person. He's got tremendous ideas. He's a transformative leader, and he's really changing the healthcare system. So that's really what struck me, is just getting to experience him in that way. And then, even though he could talk about making changes at so many different levels, at the governmental level, the Biden administration he talked about, and policy regulations. He also talked about what we could be doing differently in terms of access. And he's changing the model. He's thinking about it at so many different levels, and yet he's able to bring it down to the very personal, individual level, right? Which is what ultimately we all think, okay, what can we do differently? And he had a great message on that front. Be your own advocate. So, don't think that other people are always going to be looking out for you. If you're experiencing a challenge, then don't hesitate to speak up. At the same time, be aware that we're all part of pretty powerful networks. At least we have 5 people, according to his view, of really close friends or family members who will look out for us. So let's be open and vulnerable with them in case we're experiencing any issues. Maybe they'll help us identify that there's a challenge that we need to do something about. And then I think the one that you and I love the most is just do an assessment and keep doing an assessment. Be in touch with yourself, get some feedback. There are free assessment tools like the one you took on Mindoula. I think what a great idea. Just go and do assessments from time to time. Make sure you know how you're doing. It shouldn't be something that has a stigma attached to it. It's just like monitoring your steps or checking your heart rate. It's just another way to know that you're healthy. So those are a few things that struck out at me.
Exactly. I love that. I love the last point that you made about like monitoring your steps, because I think that's where we need to get with behavioral and mental health. People
Mm-hmm.
need to stop seeing it as just a problem that you're treating, like diabetes or cancer or something like that. It's not. It's something, an ongoing thing that you can do to make sure that you're on the right track. And if something pops up, then you're seeking treatment then, before you're already in a bad space and it's a really tough climb for you.
That's right. That's right. Because it's ultimately behavioral health. We use that term, but it's really mental health. And mental health means mind. We all live with our minds. We all know the stress we're under. We know the fear, the anxiety, the pressures, overwhelmingness. We all experience it. So it's not hard to see how a typical normal person like us can at times go through stress that just pushes us over our limits. The society is very complex. We're dealing with a lot of challenges. We talked about them during this interview. The pandemic is one, and generally all of the craziness in politics, the divisiveness that we're facing, social justice issues. So I think this is a good reminder that our minds are under stress, and we need to just be in touch with how we're doing and make sure we take a moment to reflect on that.
Exactly. It's not a weakness within you right now. It's actually a weakness in the system that's not
Mhm.
supporting people properly. So it was a great conversation. And I really hope that you guys join in and listen to it or watch it next week. It's going to be a great conversation on Thursday. So thanks so much for joining us, and we'll talk to you soon. Bye.
All right, thank you.